This is Dr. Sivakumar, and I'm joined here by Dr. Fahim, and we're going to be discussing today the management of diabetes during the month of Ramadan. So, welcome, Dr. Fahim.
Thank you very much.
So, can you tell us a little bit more about the concept of Ramadan?
So Ramadan is the holy month for Muslims and all around the world. People who practice the faith of Islam, they fast for this holy month, and there are actually 30 days of fasting.
Okay, and so from when to when does the fast last?
So people fast from sunrise to sunset, and they are not allowed to eat or drink even water during this period of time when they're fasting.
Okay, so during this period of fasting, it becomes very important for patients with diabetes to understand how to manage their blood sugar levels, because there are a number of medications that may need adjustment. So there are a number of medications that can cause low blood sugars, and then there's other medications, usually the newer ones, that are less likely to cause low blood sugars. So of the classes, there's a class called the DPP-4 inhibitors, the GLP-1 receptor agonists, and then the SGLT2 inhibitors, which are less likely to cause low blood sugars. Now, an older medication called metformin that a lot of people with diabetes are on is also less likely to cause low blood sugars or hypoglycemia. Medications of the classes of sulfonylureas and meglitinides, as well as insulin, is more likely to cause low blood sugars. Now, it's very important before you make any dietary changes or changes to your medication or insulin doses that you discuss these changes with your healthcare provider, who can guide you with respect to whether changes even need to be made and in what form. So, what are some of the questions that patients have asked you in your clinical interactions?
So one of the most important question is actually, first, depending upon if they have type 1 or type 2 diabetes, are they still able to fast?
Okay.
Can they still fast?
Yeah, so this is again a question that you really have to ask your healthcare provider, whether it's okay for you to fast from a health perspective. Now, patients with type 1, as you know, are restricted to using only insulin for their treatment of diabetes, along with lifestyle changes such as diet and exercise. So for these patients, because they're on insulin and because they're very reliant on insulin, it's challenging to fast for long periods of time without meals. Some individuals might be able to get away with it, but they'll certainly need changes. So there are 3 types of insulin. There is the mealtime insulin, there are the basal insulins, and then there's a mixed insulins, which contain both the mealtime and the basal insulins mixed together. Now, generally, when you fast for both type 1 and type 2, there need to be less changes for the basal insulin than there is for the mealtime insulins. And it becomes even more important for patients with type 1 diabetes, because they're very sensitive to small changes in their insulin levels and their sugar levels as well. So fasting in a type 1 is challenging. It may be achieved by certain individuals depending on the stage and control of their disease. So something that you really need to speak to your healthcare provider before you undertake fasting if you have type 1 diabetes. Now, with respect to the patients with type 2 diabetes, there are patients that are on oral agents, there are patients that are on insulin or a combination of. There are also some injectables such as GLP-1 receptor agonists, which typically don't cause hypoglycemia. So for the patients with oral agents, if they're on those agents or the class of agents that don't generally cause low blood sugars, then it may not require much adjustment during the month of Ramadan. However, if you're on the agents that do cause low blood sugars, then depending on what your prior control was, there may need to be some dosage changes or there might need to be they may need to be held altogether during that month.
Yeah.
So the very important thing is for you to be checking your sugars very regularly during your period of fasting, so you know what's going on.
Another important point that I just remember is because it falls in the different months of the year, because it depends upon the lunar calendar, and so that the duration of fasting also varies from time to time during the year. This year it falls in June, and it will be falling, which is a summer month, and obviously days are longer, and it would be definitely falling in summer months for the next couple of years. Do you think that depending upon that, like based upon the duration of the fasting, it also can affect the people with the diabetes and their management?
Absolutely. So the longer you fast, the more likely it is that you can have a low blood sugar if you're on certain agents with for the treatment of diabetes.
So another important question that I usually come up with, a lot of patients ask, like, can they divide the medications in a way that they can actually still be on medications during the month of fasting and still carry on the fast?
So as we said, there may need to be either a titration in the dose down typically during the month of fasting to avoid hypoglycemia or low blood sugars during that period of fasting. Also, some of the medications or insulin may need to be held during that month, but you can't really come up with general principles there because everyone's treatment regimen is so different.
Yeah.
So it's very important that that patients speak to their healthcare providers in order to figure that out.
Now, generally, they also, because exercise is very important for the people who have diabetes, so would they be actually able to do the exercise, like the regular routine that they usually do during the fasting hours?
Oh, that's an excellent question as well. So with respect to exercise can typically cause low blood sugars if you're fasting. So exercise during the period of intense exercise or immediately after, sometimes your blood sugars can go up because of the release of counter-regulatory hormones. But for the most part, in the period surrounding exercise, you will tend to have lower blood sugars than if you were not exercising. And so it becomes even more important if you're fasting and you're limited to having excess blood sugar in your bloodstream. It's very important that medications be titrated down or insulin be titrated down. But again, this has to be individualized based on the particular person. So something that you really need to talk to your healthcare provider about before you embark on any type of exercise, whether you're fasting or not.
That's good. So people also want to know that if they are fasting, would they be able to actually carry out their routine daily activities with that? And
yeah, so generally you can carry on most of your routine activities. However, you have to consider that if you're working strenuously in your job or you're very active in your job, that's just like exercising as well. So you have to be aware that you may not actually consider it exercising, but if you're working as a delivery person, for example, and you're carrying heavy loads back and forth, then that also counts as exercise. So another thing that you really need to speak to your healthcare provider about if you're at a very active job. So hopefully that clears up some of the questions that people might have had around the treatment of their diabetes during Ramadan. Thank you, Dr. Fahim, for joining us, and thank you for joining us.